Trigger points in the pectoralis muscles, pec major and pec minor, rarely occur independently of each other. According to Travell and Simons, we rarely find trigger points in the pec minor without the accompanying trigger points in the pec major. As you can see here by this illustration, trigger point referred pain in the pec major can cause widespread pain throughout the entire upper chest region and into the anterior shoulder, and particularly disturbing down the arm. And these trigger points can often mimic true and genuine cardiac origin pain. The pec minor can cause vascular and nerve entrapment by pulling up on the ribs and entrapping part of the brachial plexus. So it's particularly troublesome when people get numbness and tingling down the hand and arm. To treat the pecs, we're going to have the client keep their hips in the middle, scooch their chest over to the side. This gives us a good ability to bring the humerus into horizontal abduction here. So what we want to do is use a pincer palpation to get a hold of the pec major fibers here. And if we want to get the inferior fibers, we can pincer palpate through and superior to the top edge of the chest here. Give me a number of discomfort.
4.
That's a doozy. So we want to usually stay below a 5-6 in discomfort to the client. Let the arm be loose. So I never want to push the arm into extension, rather let it kind of rest here. Give me a number.
It's subsided to about 3.
Okay, so it's back to a 3. Great. I'm going to move on to the next segment. Not fun, but it's definitely a something 3. So I also want to take the humerus into some range of motion while I'm treating in and through. So now I'm finished with my palpatory assessment. I can then lean in and press down and in. But again, I'm holding the arm. I could also hold the arm at the elbow while then I gently lean and press into the pec. Give me a number of discomfort.
That's a 3.
3. And again, I'm holding the arm. I could bring the arm across, let the arm be loose, noticing if the pec fibers, these anterior and inferior fibers, are able to relax while we bring the arm across. Very interestingly, how's it here?
That's 4.
4. So when I bring the arm into horizontal adduction, we're getting what I coined the phrase as contracting on the passive short. And again, we discussed that in each one of our trigger point therapy classes. So what I want to do is inhibit this uppermost trigger point, or trigger points in the pectoralis upper. So I'm going to change positions. I'm going to come from the superior angle and I'm going to adduct while I press. Let the arm be a noodle. I'm going to hold the arm here. Give me a number of discomfort I'm causing you.
So 2.
2, okay. And then we're going to bring this back down onto the stretch. Externally rotate. Give me a number here.
3.
3. Big breath in. Exhale out. There's many ways we can do active contract relax. Again, for the pec major mid segment, we're going to keep the arm abducted and flexed at 90 degrees. I'm going to resist against the wrist. Push your wrist straight up to the ceiling and hold. So we're going at about 30% resistance. I'm basically just pushing down with my thumb. After we get to about 10 or 12 seconds, big breath in. Exhale, let it go loose. Let it go loose. And we're dropping down into further abducted extension. Excellent. I'm going to change the position. Push your arm up to the ceiling again. And again, we're now activating some of the inferior fibers of the pec major. Again, big breath in. Coordinated exhale. I grab the wrist, let it go loose. Let it go loose. And again, I can further stretch. For the sake of the movie, I move the shelving unit here. It normally wouldn't be here. And let it go loose. Very good. So that's some advanced treatment techniques for the pectoralis major and of course the pec minor, which would be inferior to that. For more information, go to our website. You can click on the link below this movie, or you can go to our website and look for advanced trigger point seminars.